Welcome GCSE historians. I'd like to start today's lesson by thinking about what was a big problem with surgery. Last lesson we looked at the development of anaesthetics, which helps get rid of the problem of pain. Look at these two images here. Can you think about what problem we might be looking at today? Today we are thinking of the problem of bacteria, of infection in surgery. And we're going to look at how this was tackled through the development of antiseptic and aseptic surgeries. Could you now put as your title, how important was the discovery of antiseptics? We're going to start off with a quick recap about the problems of surgery. So here we can see a surgery taking place in the early industrial period. Around the image we have a set of problems described. I'd like you to annotate the image, so just draw a little line to link up the problem to where it's happening in the image. Now I'd like you to match up each of these explanations to each problem here. For example, if we take the first problem at the top, the surgeon would wear special clothes that would have dried pus and blood on it. It showed they had experience. We would match that with the first explanation here. This meant that the surgeons were wearing clothes that had germs on and increased the risk of a patient developing an infection. So now let's move on to think about how they tackled the problem of infection. Now, they developed anaesthetic first of all, which was great because it stopped the patient entering into shock from the amount of pain they were under during surgery. As a result of anaesthetics, surgeries became longer. Now, this actually initially led to an increased mortality rate, so it led to more people dying because the wounds were left open for longer with the same dirty conditions. So the wounds had longer to get infected. So infection actually increased following the introduction of anaesthetics. So it's even more important that they develop a theory or a practical way of dealing with infection. Now, the man who did this was an English surgeon called Joseph Lister. He studied infected wounds, and he realised that the wounds were rotting flesh. Now, he'd recently read the work of Pasteur in his germ theory, and he thought he saw a link between what he was seeing in surgery and the decaying wound and the idea that microbes cause decay. So now he started to look for a way to kill off all the bacteria in the wounds. Now, he did this by introducing chemicals, carbolic acid in fact. Now, he knew that this was used in sewage treatment, and so he thought he might be able to use it to kill off germs in a operating theatre. So in 1865, he operated on a patient with a broken leg, and he added a bandage that was soaked in carbolic acid. Now, this experiment worked. The wound didn't get infected, it healed cleanly, and from this, Lister was able to realise, antiseptic surgery is the way forward. So we call it antiseptic because anti means against, septic is like infection. So it's killing off infection that's there. So antiseptic is knowing that there are bacteria around you and taking steps to kill them off. Now, Lister developed his method. So instead of wrapping the wound in carbolic acid, a bandage, with carbolic acid on it, he went on to develop a spray, which is what we can see here, where they're spraying a mist of carbolic acid over the patient throughout the operation. We can also see it on this image here. Now, he then published his ideas in the medical journal, The Lancet, which is still around today. And although he was obviously successful, his ideas didn't really catch on. Surgeons didn't like them. And that's for a number of reasons. Firstly, lots of people still didn't believe in germ theory, so they didn't really understand why Lister's method worked. They also disliked the use of the carbolic acid spray because it dried out the skin and it left a really odd smell. So the surgeons found that it was making their hands sore, and if it's making their hands sore, they thought, what good can it possibly be doing for my patient? The problem Lister really had was he couldn't explain why it was working. He was a doer rather than a thinker. So let's now have a go at our task here on the work of Joseph Lister. Read the information on the sheet and label the speech bubbles here with the labels below. So we have 1, 2, 3, 4, 5, 6, 7, 8 different labels. Can you label these up accordingly? Perhaps it's best to print this off and colour code to show the links between the two. Now, as I explained, although Lister was right and antiseptic surgery did work, lots of people were still opposed to it. Now we're going to do a task to explore that opposition. On the next slide, you have a series of statements and a series of images. You need to match up the statement with the image. First one's been done for you. Some doctors rejected germ theory in microbes because they could only be seen with a microscope. That matches up with the image of a microscope. So can you match each of these statements to one of the images now? Now, although Lister's antiseptic surgery did work, it's not how we see surgery today, is it? Today we don't have surgeons working under a mist of carbolic acid spray. And that's because actually Lister's method only lasted about 30 years. He himself wasn't using it by 1890. That's because they moved on, they improved surgery. They moved from antiseptic surgery to aseptic surgery. Now, antiseptic is when you have a dirty environment, there are germs in the operating theatre, and therefore you use carbolic spray to fight the germs and the infection. That's why it's antiseptic, because it's against the infection. Today, however, we use a form of aseptic surgery. Now, aseptic, A means without. So this is without germs, without infection. And instead of accepting that there are germs in there and killing them off, aseptic surgery says, well, let's just have a sterile environment, which means there are no germs in the theatre anyway. That means we don't have to kill them off. So today, if you go and have a surgery, you'll go into a sterile environment, one in which everything has been thoroughly cleaned, sterilised, and so there is no bacteria in there in order to get into your wound and give you an infection. So today we've got things like steam cleaning of all of your various tools. We've got, as we can see in the image, the use of gowns and masks. We've got operating theatres being scrubbed spotless. And so we've got an environment that has no germs in the first place. Could you now please record the two definitions here of antiseptic and aseptic surgery? Now we've tackled two of the three big problems of surgery so far. Through anaesthetics, we've tackled the problem of pain and shock. Through antiseptics and aseptic surgery, we've now tackled the problem of infection. There is, however, one problem that has yet to be resolved, and that is blood loss. This won't get sorted until the 20th century.